Hello, everybody. Welcome to our web session from Germany Trade and Invest, GTAI at Medica 2021. In the following 30 minutes, we will present you trends and market opportunities in digital health in Germany. My name is Harald Mylord, and I'm Manager Digital Health at Germany Trade and Invest. Here with me is Laura Nelde from Flying Health. Laura, can you introduce yourself and Flying Health briefly?
Sure, yes. Hi, everyone. I'm Laura Nelde. I'm a Senior Insights Manager at Flying Health. We are an ecosystem for next-generation healthcare, and we support both corporate and startups in navigating the healthcare system of tomorrow, and I'm happy to share some of the insights from us here today.
Okay, so and who's Germany Trade and Invest? It is the Economic Development Agency of the Federal Republic of Germany. Our shareholder is the Federal Ministry of Economics. We have two locations in Germany, in Berlin, the actual capital city, and Bonn, the former capital city. Internationally, GTAI has over 50 locations worldwide. We are represented on all continents with local employees to help German companies. That is the trade part. We help German companies and with their export markets, and foreign companies, that's the invest part, that's where I'm working in, with their expansion plans. Our information for foreign companies, which is free of charge, includes market reports and sector analysis concerning the most important German industries. In my case, it's chemicals and healthcare. And we also do, to a certain degree, market entry analysis. We give extensive information on all legal and tax aspects of establishing a foreign business in Germany. And we all have ready information on all financial aspects, might it be financing, state support, R&D funds, these kind of things. And we are closely working together with regional development agencies from the Bundesländer, states. They have specific knowledge when site selection and recruiting is concerned. Okay, I will give you a short overview of the healthcare market in Germany. I wanted to go into the details of the numbers. Two messages are involved here. German healthcare is an important growing sector within Germany, and compared with other European countries, it's the biggest market in Europe. And the healthcare expenditure is 470 billion. That's quite a big market. So where does all the money come from? The sources of financing this expenditure. As you can see here, it comes from the health insurance, from the statutory health insurance and from the private health insurance. That makes it 65% of all sources of financing are covered by the insurance companies. And okay, the private households are also buying medical care services and pay privately for it, but the main financier of the healthcare expenditure comes from the health insurances. Health insurance coverage is mandatory in Germany, and it's divided between public health insurance with nearly 73 million insured people, and the private health insurance with nearly 9 million insured people. Do you know that Germany is one of the oldest populations worldwide? 22% of the population is at least 65 years or older. Only Japan ranks higher in this respect. So we are an old population. And that is also reflected in the growing number of care recipients. By 2030, about 5 million people will be in need of care in Germany, and as a consequence, an increase of outpatient nursing services providers and nursing homes for inpatient care, they are growing. And the hospitals, here you can see the number of hospitals, which is already one structural deficit in the hospital landscape in Germany. The number of hospitals is too high, and as you can see here, the private hospitals are increasing in numbers, while the charity-based and public hospitals are decreasing. So that leads us to the second structural deficit. We have too many hospitals with the wrong size. So as you can see, the hospitals with more than 500 beds are increasing, while the hospitals with 50 to 200 beds and with 200 to 500 beds are decreasing. That has to do with producing quality health care, and you can only do that if you have enough case numbers. And while these mid-sized hospitals don't have this the critical number of cases in certain diseases, they are not able to produce really high quality, and that usually has consequences for their market position. And the third structural deficit, of course, is that the hospitals are underfinanced. So that's also one point why the federal government has set up the Hospital Future Act and set up a fund of 3.0 billion euro, and 1.3 billion is coming from the federal states and from the hospital operators. That makes it 4 billion fund for modernizing and digitalizing the hospitals. So modern emergency capacities and digital infrastructures are funded. In digitalization, there are portals for patients, electronic documentation of care and treatment, and medication management. Also financed is IT security, because it's a big problem as well. And what is not here on the chart, but what is in the Act, is telemedical networks, so connect the hospitals with the outside world, and compensation for losses induced by COVID-19 is also one aim of this Hospital Future Act. So application can be handed in until the 31st of this year, and the federal states hand the application in at the Hospital Future Fund. Okay, digital healthcare. We already touched this with the Healthcare Act. So it's not surprising that the estimates for the market volumes of digital health in Europe and Germany are high. Between 2020 and 2025, the European digital health market will rise 50% to 232 billion euro. Germany will have 25% market share from this, with 57 billion euro. What you can say here is that in the last 4 years, the Federal Ministry of Health has adopted an amazing number of healthcare acts, which accelerated the development of digital health considerably. Undoubtedly, the rule breaker was the Digital Healthcare Act, which came into force at January 2020. It really represented a systemic opening of the market for digital health applications for 82 million health insured, and that's a big number. Okay, together, the adopted healthcare facilitated progress of different modules of the digital health system. In the following, we will go through the segments and show in which direction digitalization in Germany is developing. So first, much attention has been raised by the opportunity to apply for the DIGA directory. DIGA stands for Digital Health Application, which would enable, for example, medical apps to be prescribed by doctors. There's a slogan, app on recipe, made the round. So what is a DIGA? So a DIGA has to be a medical product class 1 or 2A under medical device regulation. It has its main function has to rely on digital technologies, and its intended use is centered around the patient, and possibly a medical doctor can be included. Product functionalities is detection, so monitoring, treatment, palliation, compensation for diseases, injuries, disabilities. So that has to be addressed. So what is the application process to getting a DIGA, the fast track into the DIGA directory? So the procedures is as follows. The developer of a DIGA submits an application. The BERFAM, the Federal Institute for Drugs and Medical Devices, which can be compared to the FDA in America, approves for 3 months they approve the requirements, so safety, quality, functionality, privacy, data security, and also the positive care effects, so the medical benefit and the structural and procedural improvements. So all this is approved. It is not, these points here is only the nutshell. It can amount to 150 criteria which are approved. So then the BaFin is drawing a decision. So if you are lucky and really good, then you go directly through the listing in the DIGA directory, which is good because then the medical doctor can prescribe your DIGA and you get reimbursed by the health insurance system. If you are not adopted, if it disapproves the application, you can go, and this is the fast track, you can go into a preliminary listing in the DIGA directory. That means you're still on the DIGA directory, but you have a phase of 12 months to justify the positive care effects and the evaluation concept. And after these 12 months, the DIGA is having a decision again, and then it approves, then you go into the listing in the DIGA directory, or it disapproves, well, then you have to sit down and think again how you can fulfill the criteria. If you are in the DIGA directory, afterwards price negotiation starts. This is a different process. I won't discuss that here. That would go too far, but important is that you get reimbursement if you are prescribed. Okay, what can we say? The DIGA is on the market, right? Also, the application process is going on since 1 year. So total number of 89 DIGA application has been handed in. And as you can see from this picture here is that the continuously approved, so the application who have directly been accepted to the DIGA directly is only 5. The preliminary approved, who have to prove it after 12 months, are 15. Here you can already see that it's apparently not that easy to fulfill all the criteria. 4 were rejected, withdrawn 42, and under evaluation reflect reflect the situation that is in an ongoing process. So there are always new DIGAs handed in, and they are under evaluation. Some of them, I think now it's not only like 20 as it is here. So in the last 3 weeks, we have approved like 4 other ones, so it's 24 already. So this is ongoing and developing. And so what therapeutic and diagnostic approaches within the total 89 DIGA applications? So what topics are covered? So the big majority is the cognitive behavioral therapy. So 26 applications that we were concerning that. Movement therapy, aftercare. And the other 50s are distributed over different topics: knowledge transfer, diary functions, monitoring, motivation, gamification, training. So what's next? So what's beyond DIGA? The next steps? Probably, or very likely, DIGAs will work as a blueprint for other applications. From next year on, DPAS, digital care applications, will start. As we have seen in the introduction, there's an urgent need to support ambulatory and stationary nursing. It will not be easy because these nursing, ambulatory or stationary, the degree of digitalization there is low, but I think it is a step to move towards DIGAs and also to apply them to the digital care applications is the right direction. Also, digital prevention will be a topic which can also be covered by digital solutions. The ministry is thinking about to enhance the reimbursement for MDA class 2B and 3. Higher MDR risk classes could then be reimbursed, but probably with an even tighter set of approval criteria. And on the DIGA side, it is foreseeable that they will be integrated into the electronic health record, where Laura will tell us a little bit more of it in the following time. Yes, as I said, not only DIGAs have been made possible by the legislation, but under certain conditions, teleconsultation, telemonitoring, and other telemedical procedures are allowed and reimbursable. So, Laura, what is already possible with telemedicine, and what kind of business models are evolving?
Yeah, so telehealth and everything adjacent has sort of been slowly emerging in Germany. And I think in order to understand the market, it's important to know that actually telemedicine is still a really new field in Germany, because until 2018, it was actually not allowed to conduct like remote consultations were banned in Germany. And since then, we can actually see that a lot of federal states have liberalized that. So now there's actually only one state left that has not liberalized it, but everywhere else you can conduct telemedicine. But in sort of the first 2 years after the adoption, we did not really see a lot of telemedicine happening. And the thing that changed it was the pandemic. And as you can see on the next slide, there was a really big jump in the numbers of telemedicine and the numbers of hours that were conducted via telemedicine pre and post pandemic. So if you look at this, actually in 2019, there were only about 10 hours of telemedicine that were being billed between March and June 2019. And then the pandemic came, and during the first lockdown, that number went up to 20,000 hours that GPs billed using telemedicine. And so moving forward, we are definitely expecting a slight drop post-pandemic. We've actually already seen that post-lockdowns, that the numbers went down a bit again, but we are also very certain that we will not go back to the same very low level that we had prior to the pandemic, because people, both patients and healthcare professionals, have gotten used to this new modality. And what has also been emphasized is that in one of the most recent digital acts, one as Harald also mentioned earlier, there has been an emphasis on telemedicine as well. So, for example, in the future, doctors will be able to conduct more hours of telemedicine. So unfortunately, we still have a limit, and they can do a maximum of 30% of all treatments per quarter via telehealth, but this has been increased slightly. There's also the possibility from January onwards that the electronic sick note will be available after a telemedical consultation, so you don't have to go in to the doctor's practice anymore when you just have a cold, for example. And quite interesting, and I think that will change business models as well, is that other providers aside from GPs will be able in the future to also conduct their services via telemedicine. So for example, midwives or a speech therapist or a physiotherapist will be able to conduct surgeon consultations online only. And then lastly, there's also more opportunities for hospitals to use teleconsultations. So that sort of shows you what is possible in terms of regulations. I think what is also important to know if you're thinking about doing business in telehealth is that there are basically two main business models in Germany. One is B2B and one is B2C. So for the B2B part, you are basically a software provider going to healthcare professionals and selling your software as a service to them so that they can use it to talk to their patients via video or via phone. And what is important here is that if you are going to do that, you actually have to be licensed by the National Association of Statutory Health Insurance Physicians, because if you're not licensed by them, then the doctors won't be able to bill the hours that they've spent in video consultations. And of course, that is something you really need to consider doing, because otherwise no doctor would use that. The alternative route, and I mean, that is what we see all over the world happening as well, is going B2C and basically providing virtual care services directly to patients. There are already some providers in Germany. There are also some that have actually chosen sort of a hybrid model to target both these markets and make sure that their services are fully covered by the statutory health insurances so that patients don't have to pay out of pocket, because as Harald showed earlier, the biggest spending in Germany in the healthcare sector definitely comes from the statutory health insurances and not out of pocket. But in order to expand services of telemedicine, there will probably be some out-of-pocket spendings for patients necessary. And we're seeing a slowly expanding landscape there, where telehealth is moving beyond just having the video chat with their primary care physician, with their GP, but actually using it for other types of diagnosis. So the first we are seeing is teledermatology, where we have several providers that are already offering photo diagnosis. So you can take a picture of your skin and get a diagnosis without having to go in to the doctor. But unfortunately, these are not yet covered by the statutory health insurance. And a similar thing is happening in the field of at-home testing, which we think will really be the next step to truly expand telehealth. And unfortunately, today there's no reimbursement, but some providers such as Teleclinic here have partnered with direct-to-consumer brands to offer these test kits for the home. And we think really moving forward that this will be one of the biggest benefits for telehealth, to include more services and then be able to provide more to the patients and have a truly integrated virtual care platform.
And the access to an electronic patient record for every insured is a centerpiece for the gradual connection of all stakeholders, may it be patients, physicians, hospitals, insurances, therapists within the German health system, which have formerly been insufficiently in exchange. So Laura, what are the next applications to be integrated into the electronic health record, and what value added do you see for the German health system?
Yeah, I think the value add maybe becomes already clear when you look at these pictures, because in the past, bringing all your documents, all your records to the doctor very much looked like the person on the left here, where they had a bunch of different kind of documents, diagnosis, none of this in a structured electronic format. They had to carry that all around to show to a doctor if they went, for example, to a new practice. But as of 2021, Germany has finally introduced an electronic patient record that every statutory health insurance actually has to provide to the insurees. So every patient in Germany now has the right to have such a digital record. And this digital record really is the central element of our national e-health infrastructure, which is also called the telematics infrastructure, or short, the TI. And this electronic patient record, the EPA as we call it, is the central element for the patient to interact with the e-health infrastructure and allows them to compile basically all their documents related to healthcare, all their data, all their previous diagnosis, and then be able to share that with a healthcare provider, with a doctor, if they want to. And all of this is running on this really safe telematics infrastructure, which makes sure that all data security and data privacy issues are taken care of. And as Harald mentioned, this introduction is sort of occurring in multiple steps as the national e-health infrastructure is being rolled out. So is the EPA. And so we started this year with patients and GPs, or the outpatient sector, being connected to the EPA and being able to access that, being able to set one up. But in the future, there will be more. So from January onwards, hospitals will be connected. So there will be an exchange of data between inpatient and outpatient sector that is possible then. And also we are expecting, or there's already plans for other healthcare professionals to be added to the platform subsequently. So again, this will be physiotherapists, midwives, and so on, who would also be able to access the EPA if the patient would like them to. And not only is the access being expanded, but the EPA itself is also set to be developed further through new features that are introduced. So it's possible to think of these as new features, as new functionalities, such as vaccination records or the physician's letter, that will all be digitalized. And this is really where the potential of the EPA is coming in and making sure that Germany is a competitive location moving forward. And on the next slide, I wanted to also give you a brief outlook to say that it doesn't really stop at the electronic patient record, but there are more services and tools that are already being planned as part of this whole e-health infrastructure in Germany. And two of them that might be relevant for you, I've listed on the next slide, where we have the e-prescription, which will really have a fully digital and seamless way for patients to access prescriptions and be able to use them, which will make a big change for telehealth providers, but also for mail order pharmacies who can broaden their businesses due to this fully digital way. And then the second step that might be interesting is that there's a new messaging standard, a new communication standard for that private actors can comply to. So Tim, for example, allows companies to build tools, to build chat tools that are running on the telematics infrastructure and enable the German healthcare system to communicate within and across siloed healthcare organizations.
Oh yes, very interesting. What also has been made possible by the Digital Healthcare Act, the different ones, is improved access to patient data for research. The use of patient data includes the possibility to gain insights which could potentially result in new precision medicine, prevention approaches, new epidemiological strategies, or innovative pharmaceutical ingredients. The potential is enormous, but so there are the data security hurdles which have to be considered. So, Laura, where do we stand concerning the use of patient data, and will the risks outweigh the opportunities?
So we're still actually at the very beginning of using patient data in Germany, and the biggest player for that will be the research data center that is currently being established. And this research data center is located with the Federal Institute of Drugs and Medical Devices. And what happens there is that they receive data, billing data from the statutory health insurances. They aggregate and anonymize that, and then they provide these data sets to specific and clearly defined research institutions. And these research institutions are, for example, university hospitals, universities in general, or also institutes such as the IQWiC, who are able to apply for that. And because there are only certain institutions that are able to apply for, this is really protecting the data against misuse, and also the fact that everything is anonymized and aggregated makes sure that patient privacy is also being kept. And the research data center is right now sort of the very beginning of how we can use this patient data in Germany. So first of all, there will only be this billing data from the statutory health insurances, but in the future, there will be more data added to it to really make it sort of a hub of health data. And the first step there is that data from the electronic patient records can be shared with the research data center. So a patient is in the driver's seat here. They can decide if they would like to donate some of their data, which will, of course, be, again, anonymized, but they can decide if they would like to share that. And then again, research institutions will be able to access that, use that to develop new products, new technologies, and improve care. So I think overall in the future, this is the first step to really make sure that health data in Germany is being used to improve the healthcare system for everyone.
Yeah, so Laura, thank you very much for this valuable insight. I think we managed to show the direction and the developments in the digital health modules in the different markets. I think it's a very exciting and competitive process. So we are at the end of our presentation. You can meet us at the Medica. We are at the Medica at Hall 15, booth VK 33. So you can directly contact us from Monday to Thursday. And you can also get in touch with us through our contact dates. Yeah, thank you very much for your attention, and maybe see you on the Medica.